This is a video on the cardiac cycle. A lot of people ask about it. It can be confusing, and it's a really important topic. So we'll start with diastole. The heart is relaxed and filling, okay? The ventricles have relaxed. Now the heart is just filling with blood. So what's happening in the right heart? So in the right heart, blood's coming from the superior vena cava, right? That's draining deoxygenated blood from the head, neck, and upper extremity, and that's flowing to the right side of the heart. And then the inferior vena cava down here is bringing blood up to the right side of the heart, and that's coming from the lower extremities and the trunk. We actually have a third structure here called the coronary sinus and deoxygenated blood from the myocardium. So great cardiac vein, middle cardiac vein, small cardiac vein, they're bringing deoxygenated blood from the myocardium. They all drain into the coronary sinus, and that drains in the right side of the heart. This is going to flow past the tricuspid valve, right from the right atrium to the right ventricle, right? So when this heart's relaxed and filling, the tricuspid valve is open, the pulmonic valve is closed. We don't want blood to leave the heart, but we're trying to fill the heart up. So blood doesn't fill the atrium and the ventricle, it's just flowing right through. Now, simultaneously, right, because it's happening on the left side of the heart, at the same time, blood's coming from the pulmonary veins, right? The left pulmonary vein is coming from the left lung, there's two of them, okay? And blood's coming from the right pulmonary veins from the right lung. This is bringing oxygenated blood back to the heart from the lungs. So in the lungs, oxygenation occurred and gas exchange occurred between the alveolar air and the alveolar capillaries. Now it's red, right? Because of course bright red just means arterial blood, and if it's blue it means deoxygenated blood. That's just like a given thing with writing on a whiteboard. So blood is going to be flowing past the mitral valve here. Okay, so mitral valve is open and the aortic valve is closed because we don't want blood to leave. Okay, so to recap, our atrioventricular valves, those are our tricuspid on the right, mitral on the left. Our semilunar valves, our pulmonic valve on the right side of the heart, aortic valve on the left side of the heart. Okay, those are semilunar valves. Okay, so semilunar valves closed, atrioventricular valves open, blood's coming into the right side of the heart from the SVC, IVC, pulmonary veins on the left side of the heart. And the heart's filling with blood. Okay, we're starting to fill the ventricles up with blood. Now something happens. Well, what happens? Well, the SA node spontaneously depolarizes because it has leaky sodium channels. The resting potential in those nodal cells is about negative 60 millivolts, negative 40 is threshold, and sodium ions just kind of leak in on their own, so it'll spontaneously depolarize. And then we know the parasympathetic and sympathetic nervous systems, they can speed the heart up or slow the heart down. That's for another video. So SA node spontaneously depolarizes, carries the signal through the atria, through the intranodal fibers and the Bachman's bundle, and it carries it through. So atria contract. They're going to contract and they're going to shove their blood into the ventricles and fill the ventricles up even more. Okay, and now this volume of blood that they fill up with, this is going to be called our end diastolic volume. So this is when the heart's the most filled with blood. And this blood getting pumped in there, a lot of times we refer to this as the atrial kick. The atrial kick is some excess blood getting pushed in the ventricles. This is going to contribute to our cardiac output. So a patient with AFib, where their heart's just doing this, or their atria are doing this, I should say, it's not VFib, it's AFib. The ventricles are squeezing blood, but they're not getting the extra blood pushed in there from the atria. Okay, and what happens after the atria contract? These valves close. Why do they close? The atrioventricular valves are going to prevent blood from regurgitating back up into the atria when the ventricles are contracting, unless they're not working, like a prolapse or a stenosis. Then we can get tricuspid or mitral regurgitation. So those close. That creates the S1 heart sound, the turbulence of blood of the atrioventricular valves closing. That creates our S1 heart sound. That marks the end of diastole. That's it. Then systole starts. The ventricles start to contract. Why did it take so long to contract? Because there's a delay at the atrioventricular node, which is roughly here, of 0.12 to 0.2 seconds, or we can call it 120 to 200 milliseconds if you're learning about ECGs. So then the ventricles contract. But we had that delay. The whole point of the delay is so the atria can shove their blood in, close those valves so the ventricles are maximally filled with blood, and we prevent regurgitation and all those things. Now, in early systole, we're building pressure. We're squeezing that volume of blood. Why are we squeezing it? Well, if we want the pulmonic valve to open, the pressure in the right ventricle has to overcome the pressure in the pulmonary trunk. On the left side of the heart, we just squeeze the blood in the left ventricle because the left intraventricular pressure has to be greater than the pressure in the aorta. So that's like the afterload we're pushing against, the resistance. So we're going to squeeze, 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 and then what's going to happen? Okay, we did it on the right side of the heart. This valve opened and blood got ejected to the pulmonary arteries, which are taking deoxygenated blood to the lungs. And then the left side of the heart, What happens? The aortic valve opens, blood is ejected into the aorta and takes oxygenated blood to the body. Okay? The aorta comes down here, underneath the heart, and it's going to run with the inferior vena cava, all that good stuff. Okay, blood's ejected, that's great. And now the ventricular blood is a lot lower. Is it empty? No, the heart's not empty, but we have a lot less blood in the heart. So this volume of blood at the end of systole is going to be called our end systolic volume. So guess what? If you subtract this volume of blood from the end diastolic volume of blood, that difference, that's the blood that left the heart. That's what our stroke volume is called. So how do you calculate stroke volume? Your end diastolic volume minus your end systolic volume. There you go. There's your stroke volume. Now what happens? Well, these valves have to close. So these valves will close as the pressure changes. And when the semilunar valves close, this creates a sound. It's called your S2 heart sound, or your dub, the turbulence of flow when these close. And these are really low pressure now, so guess what happens? That's going to cause these valves to open back up. The atrioventricular valves open back up because the pressure is so low in the ventricles, it almost creates like a sucking effect, and blood flushes back in to the ventricles, and guess what? We start all over again. That is our cardiac cycle. So S1 marks the end of diastole, S2 marks the end of systole, AV valves open back up, we start all over again.